Ever wondered why your newborn is crying so much? Welcome to our enlightening discussion about the top 10 queries new parents often have about their little ones. We begin our countdown with the question that's probably keeping many of you up at night. Why does my baby cry so much? Crying is a baby's primary form of communication. It's their way of telling you they need something. This could be due to a variety of factors. Perhaps they're hungry, and their little tummies are demanding sustenance, or their diaper is dirty and uncomfortable, prompting an understandable reaction. It could also be that they're tired and need some help drifting off to sleep. Sometimes they just want some attention, a cuddle, or a soothing song. So, next time you hear those tears, remember to stay calm and try to understand what your baby might be trying to tell you. Remember, babies can't express themselves with words, so crying is their way of communicating their needs. Next, we tackle a common worry. Is my baby eating enough? This is a question that often troubles new parents. So how can you tell if your little one is getting enough nourishment? There are a few telltale signs. Firstly, a well-fed baby will have regular wet diapers. On average, you should expect about 6 to 8 wet diapers a day in the first week. Secondly, steady weight gain is another good indicator. While it's normal for newborns to lose a little weight in the first few days, they should start to gain it back after the first week. Finally, if your baby seems content and satisfied between feeds, this is usually a good sign they're eating enough. Remember, every baby is unique and their feeding patterns can vary. If you're concerned, don't hesitate to seek advice from a healthcare professional. If your baby seems content and is gaining weight consistently, chances are they are eating just fine. Moving on to the 8th query, why is my baby's skin peeling? This is a question that many new parents find themselves asking during the first few weeks after birth. It's a common yet often surprising part of newborn development. You see, when babies are in the womb, they are surrounded by a protective substance called vernix. This substance helps to keep their skin moisturized. Once they are born and exposed to the air, this vernix begins to dry up, leading to the peeling of the top layer of their skin. This is a completely normal process and not a cause for concern. It's their skin's way of adjusting to life outside of the womb. If you notice peeling, you can help your baby's skin by applying a gentle baby moisturizer. But remember, while it might seem a bit alarming, peeling skin is a normal part of newborn development. Ever puzzled over the question, why does my baby sneeze so much? We're here to clear up the confusion. Newborns naturally sneeze a lot. It's not because they're catching a cold or developing allergies, though it's easy to assume that. In fact, it's their little body's way of clearing their nasal and respiratory passages. You see, babies are born with very small nasal passages, and they can easily get blocked up with tiny particles like dust, lint, or even milk. Sneezing is their natural reflex to clear these blockages and ensure they can breathe comfortably. It's a protective mechanism that helps keep their respiratory system functioning smoothly. Remember, babies are still adjusting to life outside the womb, and their bodies are learning and adapting to their new environment. So, frequent sneezing is not only normal, but it's also a good sign that your baby's body is doing exactly what it should be doing. So, no need to worry if your baby is a frequent sneezer, it's just their way of keeping their tiny noses clear. Next up on the countdown, why does my baby sleep so much? New parents often marvel at the amount of time their newborns spend sleeping. It may seem like they're always napping, but this is completely normal. In fact, newborns may sleep up to 17 hours a day. Yes, you heard it right, up to 17 hours. But why do babies need so much sleep? The answer lies in the rapid development they're undergoing. During their first few months, babies experience significant physical growth, including weight gain and increase in body length. They're also working hard on their cognitive development, learning about the world around them every time they open their eyes. Sleep plays an integral role in these growth processes. It's during sleep that the body restores itself, building new tissues and strengthening the immune system. Similarly, sleep is crucial for brain development, helping to consolidate memory and learning. So don't worry if your baby seems to be sleeping all the time. Remember, sleep is vital for your baby's growth and development, so let them sleep as much as they need. Halfway through, we address a less glamorous but important topic. Is my baby's poop normal? Let's dive into the nitty-gritty. Newborn poop, or meconium, is typically sticky and greenish-black in color. After a few days, it transitions to a yellow, mustard-like color with a loose, grainy texture, especially if the baby is breastfed. Formula-fed babies may have slightly firmer, light brown stools. The frequency varies, but it's normal for a newborn to poop after every feeding, or up to 10 times a day. However, if your baby has fewer than 3 bowel movements per week, that might be a sign of constipation. On the other hand, If the stools are extremely watery or mucus-filled, or if they contain blood, it could signal an infection or allergy. Remember, these are just general guidelines. If you're concerned about your baby's bowel movements, don't hesitate to consult your healthcare provider. On to query number 4. Why does my baby hiccup so much? Hiccups are common in newborns and are usually the result of swallowing air during feeding. When your baby gulps down milk, they can also swallow a lot of air, which can lead to hiccups. Hiccups are typically harmless and should not cause your baby any discomfort. They're simply a natural part of your baby's development. In fact, you may have even noticed your baby hiccuping while in the womb. These bouts of hiccups tend to decrease as your baby gets older and their digestive system matures. It's also important to remember that each baby is different and what's normal for one might not be for another. So, those frequent hiccups, they're usually no big deal. But like with any aspect of your baby's health, if something doesn't seem right or if you're worried, don't hesitate. Always check with your healthcare provider. Coming in at number 3, why is my baby's head so soft? Babies are born with some amazing features that help them adjust to life outside the womb. One of these is the softness of their head, particularly the presence of soft spots or fontanelles. These fontanelles are gaps between the bones in the baby's skull. They might seem alarming at first, but they're perfectly normal, and they serve a very important purpose. During the first year of life, a baby's brain grows at an astonishing rate. These fontanelles or soft spots allow the skull to expand and accommodate this rapid brain growth. The largest one is typically found at the top of the baby's head and is about the size of a quarter. These soft spots also make the birth process easier by allowing the flexible bony plates of the skull to move and overlap as the baby moves through the birth canal. So those soft spots on your baby's head, they're designed to accommodate your baby's rapidly growing brain. Almost at the end, we address, why does my baby grunt a lot? If you've noticed your newborn making grunting noises, don't be alarmed. This is a common query amongst new parents, and it's often a sign that your baby is learning to pass stool or is trying to get comfortable. As newborns navigate their new environment outside the womb, they need to figure out a lot of things. One of them is learning how to use their muscles to pass stool, and this can result in grunting. Additionally, babies may grunt while trying to find a comfortable position to sleep or relax. It's a new world for them, and they are just beginning to figure out how their little bodies work. However, if the grunting is accompanied by other symptoms like difficulty breathing, it's important to consult a healthcare professional. Remember, newborns make a variety of sounds, and grunting is usually just part of figuring out their new world. Finally, the most asked query, why does my baby stare at me? The answer is both simple and fascinating. Newborns are incredibly intrigued by faces. They're like little scientists, eager to explore and understand their new world. Their vision may not be fully developed, but they can make out shapes and contrasts, and the human face, especially their parents, is a particular source of fascination. This intense gaze is part of their early visual and social development. They're learning to recognize you, to distinguish your features from others. It's an essential part of their bonding process. Every wrinkle, every smile, every expression you make, it's all data they're absorbing and processing. It's not just a stare, it's an expression of curiosity, of love, of recognition. So, next time your baby stares at you, know that it's their own unique way of connecting with you, of saying, I see you, and you're important to me. So when your baby stares at you, they're simply learning about you and their world. It's their way of bonding with you.